Okay, troubleshooting. We'd spoken about concerns that the team might have, about the functioning of the office, and we often discuss that in our meetings. Dealing with patient dissatisfaction. Whenever somebody has a complaint or a query, I always know about it, and we always try and figure out. A lot of it has got to do with a fundamental misunderstanding of how we operate. It's also got to do with the system doesn't fit everybody's needs all the time. Because, for instance, my partner, Dr. Volker Rinnensland, I don't know how many of you know him, he has a geriatric practice. You know, a lot of his patients are much older, and he really struggles with caring for a lot of elderly people, and so it's not going to work for him to have a same-day booking system because of people's mobility, and it's just more difficult for people to get in the same day and get seen. If they have to be fetched somewhere they have to organize a ride, they have to be fetched and brought in with a wheelchair and stuff like that. So it doesn't always work for everybody. Flexibility, being able to flex when you need to. Are we meeting the demand? I think I've already touched on that. Key supports, the office staff and the team huddle in the morning. My spouse has been extremely supportive because she sees that when I get home at the end of the day, I'm less frazzled, and she sees that I can take more time off, and that quality of life has improved. We get a lot of positive feedback. I would say that 99.9% of people who I look after are extremely happy with the new system. The small percentage of people who are unhappy, as many of you who work in offices would know, often make your life a misery, though. It often makes up for that, for the happy people. It's amazing how a few people can really make life miserable. But most people are very happy. The support of peers in encouraging, especially others who do advanced access, has been great. Quality improvement staff in the province as well as locally. The Health Quality Council. Going to IHI was a revelation. I got to go into a workshop with Dr. Mark Murray. And does anybody know who Dr. Mark Murray is? Yeah, he's the guy who came up with the concept of advanced access. Him and Catherine Tainter from the States. They basically came up with a concept. And the whole reason why it's called advanced access because it had to be called something. Okay. All right, it's really just a group of concepts on how to be more efficient and how to be more available in terms of access. MCIB and the new billing codes, well, the reason why I put that in is that I think in the future we're looking at the possibility of being able to do some telephonic consultation with people, thereby not bringing them into the office, and that's going to improve flow in the offices. And it's also going to mean that from an economic point of view, the patients and the people aren't going to need to leave their job for 2 hours to come and sit in Jason's office waiting to be seen, even although it's cozy. They're not going to be taken out of their job. You'll be able to deal with them telephonically. The other thing is group visits and stuff like that. All these new concepts which the provincial government seem to be embracing, which hopefully is going to make us more efficient in our practice. Certainly if you practice advanced access, I can see it playing a huge role. The impact of CPR for patients. I don't know how many of you have seen this slide before. Can you just put your hand up if you have seen something similar to this before? Okay, this is what's been measured, guys. Okay, this is just not, I didn't dream this up. This is something that's been measured. It improves continuity of care. Your patients are less likely to attend a walk-in clinic or go to the emergency room. As a result of that, they'll be on less prescription meds because they see you over and over again instead of seeing another and another and another doctor. They'll have less special investigations because, I don't know if you guys are aware, but we're still busy working on the electronic medical record, and so I can see somebody today and order blood work and ECG, and they'll go and see a specialist the next day, and that'll be ordered all over again. Okay, and so less special investigations happen because they're only seeing one person, and as the family doctor, you make sure that the investigations get forwarded with referrals appropriately. Less specialist visits because they are less likely to see a doctor that they don't know, so they're less likely to be referred to a specialist. As a result of that, less hospitalization as well, because the emerge doc doesn't know them, is more likely to admit them than if they see you at the office with their complaint. It might be something that you've dealt with before. Okay, shorter hospital stays and overall increased patient satisfaction. That's been measured. This is why this is so awesome. Okay, the impact of clinical practice redesign, improving quality of life for the team, and what I'm talking about here is not just the fact that I can get a Friday afternoon off, but I'm talking about actually working in the office. For me as a family doctor, I see less people who come in with a list. You know how you get your list out and say, I've only got 10 things on my list today, doc. The way it works is that the clients know that they can access their doctor and they're not going to wait several weeks. And so there's no need to come in with a list, because you can see your doctor about your sore toe today, and you can come and talk about your hypertension or your diabetes in a couple of days. You don't have to do it all in one day. So less of those multiple visits, the doctors that we so often have to deal with, which is really great. We have less no-shows, okay, because you don't have people booking 2 weeks in advance and then forgetting about their appointment. So there's a lot less no-shows, so that's a lot less frustrating for the healthcare team overall. In terms of rebooking, because I do obstetrics, I'm called out of the office, approximately on average every second week, maybe sometimes a little bit of time every week. And if you already have a fairly open schedule, it's a lot less chaotic for the office staff to rebook your day, if it isn't booked to begin with, right? You suddenly call at 8 o'clock and say, you know what, I'm going to be late because I'm at the hospital delivering a baby. It's much easier to reschedule just 2 or 3 people who are booked at the beginning of the day than it is to reschedule your whole day. Okay, and the other impact of CPR is, like I said in the previous slide, because of all of that, it costs the healthcare system less. Challenges educating the population. I think that we have 2 generations that are particularly difficult to get to understand and to buy into the concept of advanced access. The one generation are the real elderly who've been doing things the same for the last 60, 70 years, and they don't really see the need to change. Why should I have to change? I've always done it this way. And so that is challenging and requires a lot of education. The other thing, and I call this the McDonald's syndrome, I blame it on fast food places and stuff, is the younger people have instant everything when they want, what they want. And so they want their doctor's visit to fit into their schedule. They don't want to have to fit into your schedule. And those are often the people that do walk-in clinics over the weekends and after hours, because they're just too busy to come during a regular day to see the doctor. When I was a kid, when you were sick, everything stopped and you grabbed your appointment whenever you could and you went and saw the doctor. Now people want to carry on what they're doing and have the doctor fit into their schedule. There is an early morning rush on the telephones. It is quite busy for our office staff. The other challenge is improving supply and demand, and just an example that I'll give you is us losing 5 family physicians recently in Moose Jaw, and suddenly I thought I had 2,500 patients, but I didn't realize that 500 people had been doing walk-in clinics for the last few years because it didn't suit them. Now suddenly the walk-in clinic option isn't there because they're all closed, and they all want to come back. So suddenly you've got a sudden shift in the demand, and that is challenging, and that's always going to be a challenge, and I don't think I myself am going to fix it. It's like I said earlier, I think it's a bigger problem that needs to be fixed by clients/patients and the entire healthcare system, and everybody doing their own little bit in terms of system redesign and improving systems. Yeah, just to continue with the supply versus demand mismatch, panel size is too large in Saskatchewan. I think that I don't even know what the optimal panel size is in terms of family medicine. A panel size is the size of your practice, how many people you look after for family medicine. I think it's around 1,500, somewhere around there. And so most people in Saskatchewan have got a bigger practice than that. One of the things that we've done is to look at the types of appointments and the spacing of appointments and try and change that. We strive to not book off certain times in terms of doing physicals. You want to change the different types of appointments, and that has fundamentally improves the whole supply and demand mismatch. It's kind of like having one lineup at the grocery store, and whoever's first in line goes to the first available till, rather than having everybody queue up in a different line. Just believe me, it works really well. Reduced visits which do not add value. We get paid, for instance, as family doctors every 3 months to see chronic disease patients like diabetics, COPD, stuff like that. Some of them are really well controlled. I really don't think that I need to see a 55-year-old type 2 diabetic with a hemoglobin A1C of 5.5 who doesn't have hyperlipidemia or hypertension or smoke, or is obese, is motivated, looks after themselves. I don't need to see that person every 3 months. I can see that person every 6 months, or every 4 months, or every 5 months. And what that does is that opens up capacity within the system to improve your supply and demand. So reducing visits which do not add value, and the other thing is the impact of modern communication and how all those people that you bring in to go over their test results, that hopefully in the near future will be able to be done by telephone and will still be paid to do it, and it will also improve that mismatch. Doing work that could be done by others. This is a common theme in healthcare. I think I wouldn't like to measure it, but I remember once being frustrated in emergency when I was working a shift and thinking, about 30 to 40% of the work I'm doing here could be done by somebody who can read and write. Why don't you just leave the paperwork, let me be the doctor, and somebody help me out with this, and things would be a lot better. And I think that that's where it comes to looking at those systems and how they work. And that's when electronic medical records actually play a huge role as well, because you can let the computer do stuff for you, which you used to have to do yourself before, and that's fantastic.
I got one question via text message, and then you answered it. It was, how many patients do you see in a day? And you said...
an average day is 35 to 40. A really busy day is 40 plus. And if I get lucky, I see under 30.
How do you schedule follow-up appointments?
Okay, so follow-up appointments are called physiological appointments. For those of you who know advanced access, there's no sense in saying to somebody, okay, I need to see you again in a week. You need to call in a week's time and try and get through on the busy phones to get your appointment. I know I have to see that person. I book them. Okay, you have to have your first few appointments of the day pre-booked anyway, because otherwise you're going to sit and twiddle your thumbs while the first few people get in. Okay, so normally the way it works is that my afternoons are totally free, and probably the first half of my morning is pre-booked with follow-up appointments. I do pre-book prenatals, okay, and and then we also pre-book complete medicals. We haven't reached the goal yet of having medicals being able to get a same-day appointment.